The main objective of Miracle Project was promoting agricultural technologies, mainly targeting farmers that are affected by HIV and AIDS, meaning those that are living with HIV and AIDS, but also those that are affected in terms of looking after orphans or the sick in their households. But then those people had to be farmers. The project was also working on mainstreaming gender. Mainly we did training on gender awareness to the project beneficiaries so that they work together as men and women, but also those people who are discriminated in the society and also the youth. So based on the project activities, we want to see if we have contributed anything in terms of gender-related issues. Are they doing anything different now that the project has come to an end?
We are here to assess the gender outcome of this project, whether it has contributed, to social inclusion, reducing stigma, and empowering women, with technical knowledge and voice, and also participating in community, leadership. That's what we are here.
I think this type of study is important because it's looking really at two aspects. It's looking at the impact of the Miracle Project on men and women in these communities over time, over a long period of time, maybe the last 10 years. But it's also looking at the dynamics, the gender dynamics of decision making and impact with those people in those communities. We're using a combination of focus groups, separate focus groups for men and for women, and also a series of semi-structured interviews with men and women in the various communities of the project. So the focus groups are specific to a set of ages, and these semi-structured interviews are specific to gender and also some conditions, poverty-related conditions, and so on.
There are facts that some women have even become, a community leader, and also a lead farmer, putting the mother trials on their farm, and also having a number of secondary farmers, whom they are giving, technical advice and services. So this is what we would like to see, whether this project has really contributed to empower women with knowledge, and also with voice and participation in the community, and get respect, and also now how they themselves are trying, to exercise their own agency, to be actively involved, in the community. As leaders, both as technical leaders, as also community leaders.
Azimaya amenewa panova alukhala omasuka kusiyana ndi mmene analili kale. Koma panova azimaya akhala omasuka naponso tukhala nawo limodzi pa zinthu zonse, maudindo, makalabu yosiyanasiyana amene tikutheka ndithu kuwapatsa udindo, tiludya nawo limodzi ndipo tumwere nawo limodzi.
From the discussions we've had with the different groups of men and women in this exercise, the women have appreciated the coming of Miracle Project, the coming of IITA in this area, because of giving them different varieties, improved varieties of cowpeas. Cowpeas in this area are regarded as a women's crop. So as women, they have really appreciated that we have given them different varieties of improved varieties of cowpeas, in the sense that most of them are early maturing. As the area is drought prone, the women have been able to improve their livelihoods, as cowpeas are a women's crop in this area.
Ine ndilosangala kwambiri kuti neyo pa anthu onse anasankhapo ineyo ndikhale mmodzi wa gulu limene lizipatsidwa mbewu, zimene mbewu ndikalima zimandithandiza. Poyambapo ndalibe china chilichonse ndimangokhala, ndiponso sindimaoneka bwino ngati mmene ndionekera munoyi.
Soybeans and cowpeas, they came from IITA. Even the visitors come, I just make them for them soya beans and cakes. Over 5 kinds of things from soya beans. So I'm proud of IITA. I didn't know that from soya beans I'll get something good from there.
Actually, I think this has been useful, considering the stories that we've heard from the farmers, and that most of them they've been involved in this project. I think it's quite encouraging and it's useful.
We are going to use these examples that investing on people living with HIV/AIDS, especially investing on women, would definitely contribute, to empowering them, and also, to give them recognition in a society, and also to go beyond just simply addressing their health and nutrition, needs. This is an investment that's worth even investing, and trying to use this experience even to expand a possible project that would also replicate and scale out the experience of this project, which has addressed the technical needs and also the social needs of these people.